Okay, hello everybody. Good afternoon, good morning, good evening, wherever you may be in the world. Let me just fix the screen. So, okay, we got it. All right, hello everybody. Good morning. Like I said, mamas, moms to be, anyone who's watching this video, just wanted to say hello. Welcome to Jubilee Mama Empowerment. And I just wanted to just say hello again. And we're going to go into this wonderful presentation. Um, Hold on one second. Let me just see something. Okay. So we have a special guest here. Her name is Kori Brown, a fantastic friend of mine. I'll have her introduce herself in a second, but I just wanted to let you guys know the topic today. It is about postpartum depression, perinatal anxiety, and mood disorders. So Kori is going to talk to us about that and let us know exactly, what's going on with us mamas when we are having, issues after having our babies. So go ahead, Kori. You can introduce yourself. Tell us a little bit about yourself. Tell us about your profession, how long you've been doing it, and what you're doing in the world today.
Okay, well, thank you so much, Lacey, for having me today.
Hmm.
Again, my name is Kori Brown, and I am a licensed clinical social worker. I am a Long Island native. Lacey and I grew up around the block from each other,
Yes, we did.
known each other since childhood.
Yes.
So I graduated I first went to CUNY Hunter College for my bachelor's in psychology, and then I went to Stony Brook University, yay, for my
Yes.
master's in social work.
That's right. That's right.
So even before I got to social work, I've been in the field of childcare for, well, shoot, I started around I was 12. I became an aunt when I was 12.
Hmm.
After that, I was a nanny. I worked as a child counselor. I've been a daycare teacher for both regular and Montessori preschools. And
Awesome.
then I became a social worker where I specialized in children and families.
Hmm.
I also became a play therapist, which basically I specialize in children from ages 2 to 17 and
Awesome.
families.
Awesome.
So most recently, what I do now, I work for the military, teaching. As a social worker, I also teach parenting skills. That was my very first job
Hmm.
with the military. I've been working for the military for 10 years.
Awesome.
And basically, my first job was called New Parent Support Home Visitor. And what I did is I worked specifically with parents, either first child or maybe not first child, but first child to them, teaching parenting skills, also talking about mental health with parenting, play groups, what to expect developmentally, and what it is. I also have been trained as a childbirth educator.
Hmm.
So basically teaching classes on what it is. What are all the things that happen with pregnancy, after pregnancy, what to expect. So it's really a passion of mine to talk to moms and be able to kind of help decipher some of the myths and some of the things that happen and changes with
Right.
both pregnancy and after pregnancy.
Awesome. So you're,
And, mhm,
yeah. So obviously you're the right person to speak to and to present today. So
yeah.
awesome. I'm so happy that you're here. We're very excited to have you. So go ahead, tell us about this whole issue with postpartum depression and the anxiety and mood disorders.
Right. So, one of the biggest things about postpartum depression is that there's all this stigma around it. There's these myths that it only affects a certain group of people or certain economic status. There's no discriminatory, it doesn't discriminate. Basically, what postpartum depression anxiety, it is something that's a result of pregnancy. It's a form of depression. It doesn't mean that you're weak. It doesn't mean that you've done anything. It's a chemical imbalance.
Right.
Just like sometimes with pregnancy, you have gestational diabetes. It's not something that you cause, it just kind of happens. So I want to kind of dispel that. It's more common than people know. A lot, it's very underreported
Right.
because people sometimes feel guilty or shameful admitting it to their doctor or anyone around them, or they think, oh, it's just me that's going through this.
Right.
So and sometimes it can also be prevalent after traumatic birth. And if something went wrong with birth or the actual idea of what you thought the birth was going to be ends up
Mhm.
different. It can kind of
I'm a
result in.
I'm a witness to that. I'm a witness to that. Yes, absolutely.
So I kind of wanted to kind of explain some of the symptoms. And the first slide I have kind of points out what postpartum is, depression is versus something called baby blues.
Okay.
Some people may not have known the difference of it. So the first slide kind of has the symptoms of baby blues. So most folks have baby blues. And what it is after the birth, like 2 to 3 days, you might notice some of these symptoms and mood swings. So you can go from hot to cold as far as your mood within a second. You could be watching a commercial and it might be about a sneaker and you start crying. You're like, oh my gosh, that's the best sneaker, or the Snickers, or oh. And you're like, what's going on? Anxiety might pick up about you, the baby, the world, sadness, irritable. For instance, your partner or someone in the house leaves a sneaker in the living room and you chop their head off. What is that there? You're just biting people's head off. Crying, appetite, and trouble sleeping. That's pretty standard because in the first 2 weeks after giving birth, because your hormones are shifting and everything's trying to balance out. So that's pretty standard. Now, when it begins to move into postpartum depression or postpartum anxiety is after the 2 weeks and it becomes more intense. It's more severe. So you have basically the same symptoms of baby blues, but you'll notice that you might begin to withdraw from your baby, withdraw from yourself. You'll notice that you'll have a change in what we call ADLs, activities of daily living. It'll begin to inhibit, like you won't want to get out the bed. You won't want to change your clothes. Now, this is not to say that you're not going to be tired from taking care of a baby and taking care of your household. You'll have that, you'll be tired from that. But it's like you can't even function. You don't want to function. I had a client best describe it as you're just going down this dark tunnel. And it's like this black cloud that's over, this dark cloud that's just over you, and you can't shake it. And what ends up happening is you lose precious time with your baby because the months and it just goes by. And you think, okay, there's something wrong with me. This other people don't experience this, and so what you'll notice is that you might start feeling worthless, like I'm not a good mother. You feel guilt, you feel shame. You'll have severe anxiety, severe panic attacks. You might start thinking, okay, something's going to happen to my baby. Something's going to happen to somebody I love. Something's going to happen. Now, mind you, I know we're in the midst of a pandemic, and right now the world is really a kind of a scary place. But on top of that, it would be, okay, my partner's going to the store. They're not going to come back. Or the baby, it needs to be wrapped 20 times. It becomes sometimes like what folks call for OCD, it becomes compulsive. Like you can't let it go, even if you wanted to. And sometimes you ruminate. You can't sleep. You can't eat. And sometimes, so thoughts of harming yourself, suicide, harming the baby is where we start to move into postpartum psychosis. This is maybe on about 25% of the population of moms. And this is what usually people think about when they think about postpartum. They think, okay, I'm going to kill my baby. I'm going to kill myself. I'm going to, you hear about these severe cases of people drowning their children in the lakes and things like that. That's only about 25%, but it's something to still watch out for. If you're having these thoughts of paranoia, hallucinations, that's not normal. That's something that's outside of the scope. So taking a look at any of these symptoms and trying to see, am I feeling that? Is it getting in the way of my life? Is something you should mention to your doctor right away. If you're having any feelings of feeling suicidal, wanting to harm yourself, thoughts, if you have a plan, you want to get into the doctor, or if you're having those urges to hurt your baby or hurt yourself, you want to call 911 so someone can come and assist you and get the help that you need. Or you can talk to your counselor, talk to your church, your pastor. But we'll talk about some solutions in the next. But these are the general symptoms. But the key takeaway is that they're interfering with your everyday activity in your life. Understanding, like I said, you'll be tired. from all the activities, from taking care, but it goes over that threshold.
I have, I have a I have a question, Corey. Sorry to interrupt.
No, go ahead.
Now, the 25%, those that have psychosis, the hallucinations, all those kind of things, are
Mm-hmm.
are those people, let's say, people that have already had previous mental health issues like schizophrenia or any other type of depression? Does the research find that those are the people that are getting more those symptoms, or is it just anyone in general?
It can be anyone in general, but if you go to the next slide, I'll actually point some high risk populations of folks that
Sure.
could have more risk for it. But it could be anyone in general. That's what makes postpartum depression, or more so postpartum psychosis, such a kind of sneaky type of disease in
Right.
that sense. So it's something to watch out for all populations. But the risk factors that you'll see there, who is more at risk for getting postpartum or the psychosis, if you have a history of depression, anxiety, OCD, if you have other pre-existing health conditions, especially thyroid, that can, impact your mood if you have a thyroid imbalance. If you're isolated, you don't have support from friends or family or some kind of support group, you might feel overwhelmed, overstressed. If you have pregnancy complications, delivery, like I was saying, the traumatic birth, if something happens during that, if you have PMS, financial issues, stress, history of abuse, physical abuse, domestic violence, or if you were abused as a child, that can be a risk factor. And then unwanted or unplanned pregnancy, all those things are stressors,
Okay.
and could actually exacerbate what's already happening with the chemicals, the hormones in the body that are kind of driving
Mhm.
depression.
Mhm.
Um, so on this slide, you'll see just some more kind of symptoms of what you might see. The crying, the sadness, uncontrollable crying
Mhm.
that's persisting. You're going on 6 months past pregnancy, 7 months past, let's just say, delivery, and you can't shake it. What are some solutions that you have? So on the very right side of this, you'll see counseling is one option, but let me start here. Basically, what you want to do is get your partner involved. If you have a partner, a spouse, they are always usually in a healthy relationship. They're the biggest person that's observing you because they live with you. They know
Right.
what you were like before you had the baby, and they know what you're like now. So they can observe something that maybe you can't see. So get them involved. Hey, let them know, hey, if you see anything off, anything that's different, let me know. And then they might be able to come and talk to the doctor with you. That's the second thing I'll say is talk to your doctor. A lot of times you go back for postpartum checkups for the baby, but sometimes I hear, well, moms don't get a chance to get in there and get themselves checked. You want to make sure your vitamin levels are checked, because a lot of times that can kind of mask for, if you have low iron, that can make you feel depressed and sleepy. Low magnesium, you can't sleep. So all these vitamins, even though you might be still on the prenatal vitamin, you might be breastfeeding, or you might not be getting the nutrition you need because you're so busy taking care of baby and household, your vitamin levels can be off,
Right.
and that can mimic depression. So get to your doctor, tell them your symptoms, get your blood tested. The next thing is, if your doctor is not attentive, and this is happening so much, get a
Yeah.
second opinion. Get a second opinion. Don't be afraid. Just like you would for your baby. If you like, okay, this doctor is not on cue with my baby, because if you're not taken care of, then you can't take care of baby. So, and there's a lot of options for being able to virtually get that second opinion. And I'll talk about that in a minute. Getting involved in support groups. Once again, there's a lot of virtual. This is even pre-pandemic. There's an organization called the Postpartum Support International, and that's that made this slide.
Right.
They actually have an online support group that is for moms that are having postpartum issues. They actually have a military one. They have, if your baby's in NICU, they have one of those. So they have varying ones that you just log on online. It's totally free, and you have someone that can virtually come in, and you have a support, so you're not out there feeling like this is just me.
Mhm.
And also, if you can, getting out, getting some sunlight, and getting air. Sunlight, vitamin D is one of the best ways to fight depression. And getting air, exercise, if you're allowed, wherever you are. Even if you can't go outside right now because of the condition, you can go to your backyard. But you want to bring yourself and your baby if you can. Of course, protecting for COVID, but it's healthy for baby too. When I worked in daycare, we brought babies out every single day, no matter winter or rain. If it was raining, we didn't. But the air helps them sleep. Air helps you sleep. So counseling is another thing I recommend. Postpartum Support International, once again on their website, they have, and I'll put this up later as a resource list. You can call them. They can refer you to someone who's specifically trained in perinatal mood disorders. So someone who has familiarity with postpartum depression, so you're not trying to explain this to the counselor. If you're not comfortable with traditional counseling, if it's someone that a pastor, a holistic doctor, you want to be able to just, even a friend, but usually you want to get someone who's trained, because sometimes, well, friends and family may mean well, they may not have the training to recognize the signs and the symptoms and say, hey, we need to escalate this, and maybe we might need some sort of other assistance. There is medication available. Some folks are okay with that, some folks are not. That's fine, but there's medications that will not go into your breast milk. And it's only temporary, because what happens is it ends up getting to, when I mentioned that dark tunnel, it goes darker and darker, and then you look up and the year is up and you've missed out on your whole baby's first year. Yeah. And the only thing, because it's a brain imbalance, it's a chemical imbalance, just like the other types of depression, the only thing, especially if it's genetic, hereditary, if you have that in your history in your family, they may not talk about it. Some families, they keep it hush, but if you know that your mother or your grandmother or your grandfather, someone has a history, usually it shows up like alcoholism or something, people self-medicate. But if it's a history, then you're more inclined to have that imbalance, and usually only medication can balance that back out. You can try other things like meditation, breathing, holistic oils, essential oils. There are things that you can do to work on that don't include medication, but if you're to the level where you can't function, sometimes you need to get those levels back up, and then you can get off. Right. The final thing is self-care, and that'll be a discussion. I'll probably talk about that more detail later, but that might not be, you don't have time to sit there and go to a spa because you have a little person running around and you have household, but the little things that you can do, rose mask that I just discovered when I was traveling. You put it on, it smells like roses and lavender. You can find it from Amazon. And as a resource, I'll put later, there is on YouTube, there's a Dr. Nina is her name, and she has a do-it-yourself, how to have a do-it-yourself spa day. So as simple as like mixing together honey and turmeric and some brown sugar to make a scrub. Right. So something you can do that's affordable, that's in your home. And I've begun to follow her because she has some simple solutions for self-care. Journaling is a good thing to be able to do. If you can't, you don't have time to talk to somebody, you can just write down in your journal what's happening. And that way you're getting it out. So there are online places that you can do therapy with. Maven Health is one of them. And they not only do counseling, but they offer all services. They do pediatrician, fertility, nutrition, sleep coaching, career coaching, and it's a one-stop shop. They have a free blog that you can come in and ask questions. I know for counseling it's like $70 for 40 minutes, but it's all virtual. You can go back, like I talked about, OBGYN, pediatrician. They can order tests for you, labs, and that way you don't have to leave your home. And it's specifically for women. It's a healthcare company specifically for women. There is one more called the Collective. I'll put that. They have low-cost counseling. If you don't have insurance, I think it's between $30 to $80. It's a group of therapists that will see you for lower than the actual cost of therapy.
Can you say the name again? Because it kind of cut off a little bit. Say that the name of the group.
So it's called the Collective. It's called the. Hold on, sorry. Collective. The Alternative Collective is the name of the group. And I'll put the link and everything. And they do offer low cost. And they do have people right now because of COVID, everything's online as far as therapy. And so all these organizations and companies, you can get help. And that's the biggest thing, being
Right.
able to just say, there's other people, you're not going to be judged, and getting help early on to be able to help with all these symptoms that you're having.
Right. Right. Awesome. Awesome. Anything else, Kori, that you wanted to add?
No, there's just I just wanted to say that 75%, that's the statistics, folks, new moms don't report, and it ends up being stigmatized and shameful. But the thing is, it is so known nowadays. Myself working for the military, I see it a lot because you have a lot of folks who are isolated, living overseas, or
Right.
their partners deployed. And so it's become a lot more normalized to say, just like if you're wearing glasses, right? No stigma with that because it's something to help balance out what you need. Same
Mm.
thing with getting help for postpartum depression,
Right.
postpartum anxiety. You don't have to suffer. We're out here, folks like myself and others are out here to help.
Right. Awesome. I will add, I'll just tell my own personal story just really quickly. As far as tracking, I was so surprised because, my daughter, she's my first baby. I'm really surprised that when I went to the pediatrician, they had a whole sheet that I had to fill out to go through any symptoms and they wanted to track me. Unfortunately, my OBGYN did not do this, didn't even track, didn't even care to do anything on that respect. But the pediatrician and also my lactation consultant also went through questions as well to
Right.
track. And I was like, wow, this is really good. And I was trying to figure out like what was going on with me because I know I definitely had some form of postpartum depression. Like you were mentioning, as far as having like a traumatic birth or things didn't go the way that you had planned. I had to go in for what do you call it, to be induced. And I was like, oh, it's going to be a vaginal birth. It'll be wonderful. This is what I've been hoping for. Didn't turn out that way. Within 24 hours, my doctor, was putting the Cervidil, which they put up toward the cervix, like a little string of hormonal, therapy or something, and they put up in there. And nothing happens. I was dilated a centimeter the entire time. So then he tried to, break my water, like just like literally going up underneath me and hurting me, and that literally, traumatized me, honestly. So when he said that I have to have a C-section, I was blown away. I was like, are you serious? And then my husband wasn't even in the room. So I was like trying to look for him. And it was just like, where's my husband? Like what's going on? And then next thing I know, the anesthesiologist comes in. Okay, this is what we're going to do. Boom, 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 boom. It was like, didn't even give me a chance to process. And I was like, can I take a shower? You have 5 minutes to take a shower. Take a shower now. And I'm like, geez, right? So I get the shower, go in, and it was just so traumatic. And also the anesthesiologist trying to find a point to put in for my back, and I was getting numbness down my legs and all these issues, so I was getting like more anxious with that, plus having back problems on top of that. Then when the doctor comes into the room to do my C-section, no one, not the doctor, no one said anything to me. They just came over, started to cut, and I'm like, I feel that. I feel what you're doing. So they gave me more anesthesia, which made me more tired. And there's like no acknowledgement. So when my daughter was finally born, I was so like happy, but I was still anxious. They didn't even pay attention to me. Like it was just like, okay, take pictures. My husband's taking pictures, whatever. The doctors, nobody said, oh, let's just bring the baby to mom, even though I couldn't hold her because I was so weak. Let's bring the baby to mom and let's take a picture. Didn't even get a picture. And I don't think I held her till maybe like an hour later. And they were like, are you feeling better? So I held her, whatever. So then, like the next day, they had me on a PCA pump, which is giving like morphine medication. And after that, they're like, you have to come off of it and you have to get out of bed. I was in a lot of pain. So there was a lot of issue. Couldn't get out of the bed to get my baby. I had to call the nurse
Wow.
the time. I had to like call my husband. And sometimes when he was sleeping at night, he stayed, but I couldn't yell because when they cut your muscle, like your diaphragm's not working, optimally, your muscles aren't, I couldn't even yell to say, babe, help me. Like I felt like I had to just keep pressing the button for the nurse to come in. And then when the doctor would come to visit me, my OB, who was my GYN for years, he didn't even acknowledge the baby when he came into the room. He came in, looked at me, everything's fine. And then I kept telling him there was an opening in my C-section I could see. after I took a shower, there was an opening, and I'm like, is everything okay? Yeah, everything's fine, everything's good. The next day, I smelled something, and of course, I work in a hospital, so I know what it smells like to be around wounds and like open
Mhm.
wounds. It smelled funny. It smelled really bad. So I was like, there's something wrong. It smells wrong. What's going on? No, you're fine. Everything's good. Next day, same thing. I'm like, there's something wrong. So we're talking like after I was finally released from the hospital, he still never acknowledged my baby when he came in the room. He didn't care about my concerns. And even when I went to his office before my follow up, I told him something's not right. It doesn't smell right. He kept telling me, you're fine. Nothing is wrong with you. And I'm like, I know something's not right. And then I would get swelling, redness, even my stretch marks, like were inflamed. I've never seen anything like it. And I'm like, something's wrong. There's something wrong. So finally, this is weeks and weeks. I've been back to him several times to tell him something's wrong. He's telling me, like, pretty much there's nothing wrong. It's like all in my head, literally. So then
Mhm.
finally, when I go to my follow up, I talked to the nurse. I said, I'm still not feeling well. I go into the bathroom, and that's when I noticed that it was oozing. I had a
Mhm.
huge infection. The doctor didn't believe me when he came in. I told him something's wrong. It's oozing. Oh, it's fine. It's fine. He lifted like my shirt, pulled the pants down. He was like standing there, like looking like, uh oh. And then he took, this is what really got me. He took a scissor from the cabinet, dipped it in something. Who knows if it was even clean? Punctured me,
Mhm.
and it just started gushing, gushing. So I had to deal with this infection. Found out it was a bad staph infection. I won't take up too much time because I have like a lot of things to say about it, but this caused a lot of issues with me because I also had low iron, like you were saying. I had low vitamin D. Had a lot of things. Like I wasn't balanced out. I had the baby in winter, so she was born in January. So trying to take her out when it's snowing and stuff, there was like no way, and there was barely any sun outside. So I
Mhm.
was pretty much stuck, isolated. Started to feel like nobody understood what was going on with me. I felt like I was alone. I had no one to talk to. And then when you try to tell people what's going on, they don't want to hear what you're saying because they don't understand, or maybe they've never went through it. So it just took a lot. And then finally, like I was saying, when I went to the pediatrician, that's when things opened up. I was like, that's why I'm going through this. And I knew about postpartum depression. I knew all about it. But to
Mhm.
experience yourself, it's like a whole different, because I didn't really know what was going on. I just felt very like alone. So I say all this to say, moms, mamas, please do not suffer in silence. Like Kori was saying, do not suffer in silence. Open your mouth, say something to your partner, say something to, your family member, say something to your friends. I know we're like during the pandemic, and this is a very tough time because people are mostly inside. They have to wear a mask going out. You can't take the baby here. Can't take, you really can't do anything. And I think that's gonna make it, more like exacerbate symptoms a lot more. And I just want to let any mom that's out there, please, please reach out to me, reach out to anyone. Kori gave some awesome resources, and I'm sure Kori, you'll put them in the comment section. So look at that. Reach out. Do yourself a favor, really, because you don't want to get to the point where it's so bad that you feel like there's no hope, and you don't want to be hurting yourself, and you don't want to be hurting your child or anything like that. You really just want to try to get it you know while you start to feel, and then see if maybe it's a like not just a hormonal thing, but like maybe it's your electrolytes that are out, or you need more blood, or you need iron, those type of things. It could be just something so simple, or just needing the support, because I think in my case I needed support, and I think that's what was lacking. And then also having the traumatic situation with the birth of my daughter, and nobody paying attention to the fact that I had an infection and not listening, that made it like really worse. So definitely reach out. Of course, I'm better, a lot better. There's some days that you feel like a little off, but you get through it. So thank you, Kori, so much. I totally appreciate everything. I should have just come to you when I was going through this. You would have been perfect. You'd been my perfect counselor for this whole thing that I went through. I couldn't put two and two together. So next time when I have my next baby, if God plans that for me, then I'm gonna be like, Kori, listen, we gotta get through this, because now now, what are the odds of a person that's had postpartum or anxiety or whatever, any type of symptom, no matter how small or how big? What's the susceptibility of them having it the second time around with another baby or a third
Mhm.
baby? Tell us about that, because I
Sure.
love to know. Mhm.
So each pregnancy is unique, and it's like the same thing with like gestational diabetes or anything else. It could happen again.
Right.
Each pregnancy, you might not have had it in your first,
Right.
you might have it your second,
Mm-hmm.
or you might have it your third.
Right.
It's just really depending on what your body does, what your
Yes.
brain chemicals do.
Mm-hmm.
Um, just like with everything else with pregnancy. That's why it's always just good to know beforehand the
Exactly.
symptoms. If you can take my advocate of childbirth education classes or
Okay.
baby and me, like prepping, getting as
Right.
much information as you can on the front end, and so that, or even like what folks are doing now, just tuning into this
Mm-hmm.
podcast is
Mm-hmm.
just getting information so that maybe, like I said, show it to your partner. Show this to your partner so that
Right.
they can say, oh, okay, yeah, they were talking about this. You
Right.
know, sometimes it's easier to watch something than reading the big book, the what to expect when you're expecting, or that could be a little. So, tuning in and just going back to the slides that we have that just keep it, maybe put it on your refrigerator, print
Mm-hmm.
it out, put it on there so that, by the time baby comes, then you can like, okay, see,
Right.
what's happening and bring it into your doctor and just circle and say, here, this is what I'm experiencing.
Exactly. So that prep work is extremely important, and that's one thing that like my doctor didn't even go over with me. Like, this is what could happen when you have a baby. This
Oh
is what can happen
yeah.
after, and honestly, this is one of the reasons why I made the support group, because I know what I went through, and I know that there are other mothers that have gone through it because I've spoken to them, and I'm like, we need to come together as a community to really empower
Mhm.
ourselves and to help each other. And this is why I bring in the professionals like yourself and others to help us, because we don't know what life is going to bring. Nobody knows. Anything can
Yeah.
happen at any time. And this is why I say, I this is just important. It's important to me, myself, and I know it's important to other moms. And I think this is an awesome thing. Thank you, Kori, for all that you've done. Thank you for the resources. Thank you for educating us. And I know that you'll come back. And also, just to let people know that aren't in the group, that this month is the month of May is Maternal Mental Health Month, right? Am I saying it
Mhm.
right? Maternal Mental Health Month. So this
Mhm.
is one of the reasons why we're bringing awareness to this. And I think, like I said, it's definitely important for moms, and not just the moms, but also your spouses, your boyfriends, your partners, whoever, your family members. This is very, very, very important for the whole family to know, not just you, but because they have to be watching out for you as well. It's you cannot do it on your own, and that's what I really want to express that to the moms and the pregnant women. This is not something you could do by yourself. You really need to have your family support there with you. So that's it. All right. Anything else you want to add, Miss Corey?
No, thank you so much for having me, and thank
Thank
you
you.
everybody out there. If you have any
Yes.
questions, please feel free to type them in or contact Lacey, and I'd be more than happy to answer any questions you might have.
Okay. And is there any way that they can contact you if they don't want to go through me or through the group, if they want to just talk to you personally? Can you
Sure.
just give
So
them
I'll put
information?
that out there. I'll put the information in the comments that how
Okay.
folks can reach me
Okay.
and follow up, and I'll be more than happy to help and provide support.
Okay, awesome. Thank you so much, Corey. I appreciate it. All right, so
Thank you.
mamas, moms to be, have a wonderful day. Breathe it in. Mother's Day is coming. Just be
Yes.
excited. Be
Happy early
just
Mother's Day,
yes,
everybody.
exactly. Yes,
Treat
happy early
yourself.
Mother's
Treat
Day. Yes,
yourself.
treat yourself. Listen, I'm gonna go through that spa thing you're talking about. I'm gonna treat myself to a nice spa day. So, all right. Thank you so much, Corey.
Thank
All right,
you.
guys. Have a great day. Bye bye.